to pass into this exam. So especially I can recall the day you told us that asking about driving and vision is very important in Metro Delhi. So I think that was the major, you can say, flaw in our training, that we are not actually taught about how to approach the scenario and what are the safety points that we need to address to get maximum score. So I learned it all from your sessions.
All right, many thanks.
And for me, station 4 was a big, you can say, a big fear. But after following the scheme and regularly taking the sessions, I scored very good marks. I got actually 16 out of 16.
MashaAllah.
And similarly in station 5 and BCC 1, I also got 27 and 28. And I would actually like to give you all credit because you teach me how to approach in these stations.
All right. I mean, much of the credit goes to you. Okay. I mean, she was really good and she's very humble. Okay. MashaAllah. And it always takes, like for all female candidates, there's a lot of commitment. Okay.
Yes,
and to overcome them, keep on seeing patients, keep on the practice. I mean, it's a lot to do. And you do encourage, you inspire those who are, having a family or have lots of commitments and wish to go ahead. So you inspired them. That's why, we try to arrange these sessions where we include you to inspire others. So many thanks back, and, many congratulations again. And
thank you so much.
Wish you all the best ahead, Doctor. And thanks for your time to join with us. Okay, for your lovely feedback.
Thank you so much, Doctor. Thank you to you.
Okay. Dr. Binish, are you with us?
Yes, sir. Assalamu alaikum.
Walaikum assalam. How are you doing?
Yeah, alhamdulillah, I'm fine. Thank you.
Okay.
Thank you for inviting us.
All right. So all of you are
Thank God I'm not to present the case today.
Okay, I must be a very strict examiner. I know many of you say that.
Oh, yes, you were very strict. I used to have palpitations whenever you call, Dr. Binish, are you there? You will take the next case. But it was beneficial for exam purpose, because in exam, I think the level of stress was same as in this course. But other than this, I mean, even this was beneficial. But other than this, the course was really, really helpful, because your mnemonics, your approach, especially in station 5, that was very, very, very beneficial.
All right, mashallah.
Thank you so much. Thank
just
you
to ask you, just for others to know, I mean, you would be very interested, like to you, like you are taking the exam, let's say on that day, which station seemed most difficult to you? Or, I mean, after you're done with the carousel, and any tips particularly for the candidates?
That day, the station 5, I found that very difficult. Especially, it was my first station, and I was not expecting that station 5 would be my first one, and I was like half depressed by knowing that it would be my first station. But alhamdulillah, it went well, although there were few mistakes which after discussion with you I got to know. And other than that, the tip is practice. Practice. Right. Yeah. I mean, reading books and everything is important, but practice, if we don't practice, we cannot speak up there in the exam. Everything written, I don't know. I felt so. And for that purpose, your course was very, very helpful, because you taught us how to answer the questions, and what examiner really wants from you. That was very, very beneficial. Thank you so much, sir.
Thanks to you as well for joining with us, for your lovely feedback, and I've also seen that you're
thank you so much
as well. Okay, so I just want an honest opinion, like from all of you, and your success means my success. So I get to pass this I mean, in a year, lot of because as you pass in, I get the same feeling, like as soon as the result comes out, I get the same thrill as if I have passed again. So this is
Thank you,
something
sir.
that I cannot explain beyond imagination, but this is a lovely feeling. It's not just being a mentor, but expecting the results. It's just the same, like you feel, I feel the same thrill.
Y-
And it's
Thank you so
lovely.
much, because you really worked hard. You really worked hard on us, on getting the feedback from other candidates, and preparing the cases and everything. It was really difficult task for you guys. Thank you so much.
Thank you so much as well. Thank you, Dr. Binish, and best wishes ahead, inshallah.
Inshallah.
Uh,
Thank you.
you're very welcome. Dr. Suresh, are you there with us?
Yeah, doctor, I'm here. Sorry, I have a fever and cough since 2 days, and I think it's a COVID has returned. My wife and me all have the same symptoms of.
Would it be okay to speak up something?
Yeah, doctor, it's okay.
So first of all, let me introduce Dr. Suresh. Dr. Suresh is a very, very generous doctor. Okay, and I found him very smart, and he had a very good approach. And he's currently in the UK, and very soon he'll join as a registrar or somewhere up. And he's a cardiologist as well, and he has great focus, I would say. So, Dr. Suresh, please, how do you feel now once you pass this exam?
Yeah, doctor, I'm so much relieved because I'm here for more than 6 months, and I was finding. I was applying through the other channels to get a job, but it was very difficult without GMC registration.
Right.
So I'm very relieved, and I have listened about your course, and I've joined only for 1 month and about 25 days, and I didn't get so much time to read the books, and so just going through all the cases you have taught us, and and after putting 2 to 3 hours of only self study, and I've got through this result, and so it's very relieving. So thank you so much.
Mashallah, mashallah. So just to recall back on your exam day, okay, which station you started with, and which station you felt was the most difficult for you? I mean, you did pass it, but just to speak truly with the other candidates, yeah, any special point that actually helped you on that day, okay, to pass
Actually,
through?
doctor, I didn't told you initially, and this was my second time, and initially gave this exam in the last diet, and I scored 130, and but I failed in 2 skills. But at that time, my short cases was very good, and I get 76 out of 80 in the station 1 and 3. But I failed in the station 5, and I think I remember I totally gained marks 12 in 13 in out of 28 in station 5. So I was totally failed because of station 5, and I got communication 13 out of 16, and in history 15 out of 20. But this time I have gained marks about 28 in station 5, totally 100% in. Yeah, and in communication skills I got 13 out of 16, the same the previous. But in the history I got only 10 marks. Because of I think I personally feel the surrogates were very new, and they were untrained because the center was new there, and although I tried to give the differentials according to my history taking, and because the patient has a progressive shortness of progressive difficulty in swallowing for 6 months, and a history of weight loss, so I've differentiated all the points, but the examiner was not convinced about the diagnosis that I have gave them, and and the last the other candidate said that they were thinking about the 𝐒𝐞𝐜𝐻, although I have taken the history of allergy in the past and the previous, but he didn't give me any history of allergy. So I don't know how they make the diagnosis of eosinophilic esophagitis because of the progress of continuous history of a difficulty in swallowing to solids only, not liquids. So they gave me only 10 marks out of 20. So it's very difficult for me when I got the result of the history. Although in communication I got 13 out of 16, and the scenario came out the same as you told in the previous sessions about the ulcerative colitis, and he was keep asking me about the Chinese medicines, and he was although at that station also the surrogate was very new, and he was shuffling here and there, and he was not listening even properly and understanding. So I think that was a new center. That's why the problems came, and we have given them the feedback about that. So I don't know, okay, whether they has considered these points or not. Although I got 13 out of 16. But the good point is that I have learned from your course that in the station 5 that in the previous my exam, I was poor in the time management. So this time I've taken a very focused history regarding the presentation. So I've asked only few points regarding the present. Like in my first case, the patient has a history of fever and cough for 10 days, and he was about middle age patients. And at this same station, also the surrogate was the one of the examiner. He has set his wife as a surrogate, and she was very smart, so that's why it was very easy to get a history from exactly. So I took some few questions about the fever and cough and travel history and TB history and occupational history, and she has not given any clue. And then I asked about any known medical problem, like lung problem, heart problem, and then she told me that she has a valve problem since childhood, and he's on injection penicillin every monthly. So that's why I get a clue that it might be a rheumatic heart disease. And as I know, I'm a cardiologist, I know that that's so luckily I got full marks, and I've given the uh, good management regarding the infective endocarditis and counseled about regarding this thing. And the next case was about the diabetic patient, and although in that case also the surrogate was the 15-year-old surrogate, and he was very difficult surrogate, and he was not giving exactly the cause of his father condition. So the next case was that the patient has a recurrent collapses, history of recurrent collapse, and he was diabetic, long-term diabetic, and so I asked few questions about any regarding hypoglycemia, drug history, and any history of numbness or anything like that, and any postural hypotension. And so initially he was his son was very reluctant about his previous history. He was not giving any clue regarding the previous history. And every time I ask about his hypoglycemia and drug compliance, he don't know. He is not in follow up in regular GPs. But he told me about the numbness. So then I went onto direct examination, and I found the peripheral sensory neuropathy, and it is a sensory loss in the pain, bilateral stop blocking, and vibration loss. Then I addressed the concern regarding the driving in all things. Then the Viva went fine, and I got full marks.
So I must
So
admit, like when you get a diabetic case in the exam, it's not very easy because I had experience with one, and there's a lot to do. I hope you'd agree with me. There's a lot
yeah.
to do in terms of clinical examination, but I'm very glad that you scored very good marks in your station 5. Okay, and of course there are some station 2s which are killers, but there are some pointers to reach the diagnosis. Okay. Anyway, Dr. Suresh, I think what you did was lovely. Okay. And hard work always pays off. That's what we see every day, and that's why you inspire us and others as well. Okay, you really worked hard. Okay, and also you had a lot to travel. It's not easy to travel. I mean, many of them do not know like how much stress you had to go through for this exam, traveling and other things, and then taking the exam again back in another country. It's really difficult. So I really congratulate you from the bottom of my heart, and I pray that all of you pass through. Okay, so many thanks, doctor. I mean, he has
No, no,
joined
no.
us with this state, and may you recover. And so anything you wish to say at the end?
No, no, doctor. But I said that many other candidates said that this course is very really helpful, and I think everyone should at least take a 1 month course and must familiar with these new cases and whatever the tips you are giving, and it's really helpful. And especially it focuses whatever you are reading, and you should also. I mean, you are giving some. Such a presentation in such a way that we should focus on the important things and how to acquire from the patients. And I think that's very important.
Right. Thank you, doctor, and thank you very much to join us and give your important feedback. Okay. Next, we're going to go to Dr. Nisha. Are you with us, Dr. Nisha?
Yes, sir. Good evening.
Good evening, doctor. How are you doing?
Yeah, I'm good, sir. How are you?
Yes, I'm good as well. So just to introduce Dr. Nisha, I mean, she is actually very good, mashallah, and she is very determined. And just we'd like to hear from you. How does it feel now that you're past PACES?
It feels like a dream come true, sir. I mean, I didn't keep much expectations. I got it in a very short notice. Like September 1st, I was informed that there's a seat available for October 1st in UK, and whether I'll be able to take the exam there. So it was a little bit a tensionful situation for me, especially with arranging everything. And but I'm really thankful to you because you accepted me in your course, though it was a very tight schedule for you. Somehow you could accommodate me and give me some chances to practice. So I'm really thankful for that.
Okay, you're very much welcome. So just to ask you, I mean, candidates, those who go from the international center, they apply for the UK. Even I have taken all my exams in the UK, and you have taken in Milton Keynes, the place, I mean, where I very much visit very frequently there, because that's where, you know, my relatives stay by. So, I mean, what was it like to take the exam in a UK center, preparing from the international center, like you were from India and you took the exam there, the traveling and all? So any advice for those who are planning to take the exam in the UK? Would you encourage it, or what would you do? What would be your honest advice for them?
I think it's a good thing to take take up the seat in UK. It's very well organized, and there's no language problem, and it's more of communication and like how you present with a confident look to them, with a lot of smiles. And I felt it's more about the talking when you're with them there.
And no wonder you have a lovely smile and you speak very well. All right, all right, okay. So the same question that goes to others is going to come to you. Which station did you feel like you have after you've taken the carousel? Which station have you found the most difficult for you on that day?
So for me, actually, I started off with my station 5. So when I went with the station 5, my first case was alopecia, and the second case was chest pain in a cocaine abuser. So both the stations went very, I mean, I felt confident when I presented my case, and actually I finished the examination within 5 minutes. But alopecia, I didn't have much to examine in it. So I finished the examination within 5.5 minutes, and the examiner said, you still have 2 more minutes. And then he told, if you don't have anything, we can start off with the examiner question. So my station 5, I felt a little bit confident from there. And then I went on to my station 2, and then the station 4. Then I came to my clinical. When I came to clinical, the abdomen station, I felt it tough. It was some new scars which I hadn't seen before, so that was little tough. But the remaining stations, I could complete them. I felt little confident when I did them. But for the abdomen, I was little worried on that.
Okay. All right. So the aftermath, you have completed your paces from a UK center. That's a lot. Okay. And it's great to have you with us, honestly. And we always try to include candidates who have got a confirmed seat. But sometimes we get like after all the active slots filled up, we like made 4 or you open 4 new active slot. And even there were some close friends of mine, they wanted to join, but just it's the time that we need to spend, and the time you also spend with me, it's a long time, okay, and it's tiring at times, okay, but we always give preference to candidates with a confirmed seat because your success is my success. And there are times we can understand that, well, your skills where you need to further work on, and some already have a very good skill on their communication. That's what's important, and you had lovely communication skills. So I knew that you'd pass through, but the main thing was to get away with the station 5 in the UK center. That's where the difficulty is the most, what I felt from my previous experiences. I'm glad that you have passed through, and many congratulations to you again. Okay,
Thank you, sir.
done a
Yeah.
lovely work there. Okay, thank you for joining us. Okay, for your time. She is a very busy, ICU doctor. She works in intensive care, and she saves life every minute. All right. Just to check on Dr. Sahar. Are you with us, Dr. Sahar? Dr. Sahar, Dr. Nadia.
Yes, sir, I'm here. I'm here.
Okay. So we'll go with Dr. Sahar, then come to Dr. Nadia. Okay. Both are my favorites. Dr. Sahar, are you there? I think she's having some connection issues. All right, then we'll come back to Dr. Sahar. Dr. Nadia, are you there with us?
Yes, sir, I'm here. Assalamu alaikum, sir.
Walaikum assalam, doctor. So many congratulations for your lovely result. Okay, and it's a big one. So how does it feel now after passing paces?
Thank you so much, sir, for giving me a chance to speak here. And it's a dream. And I always wish that whenever I appear in PACES, I always wish to pass in first attempt. So your efforts and your teaching made it possible for me. And I'm really thankful to you for this support. And I joined my this course in 1 month before the exam. And I really find it very helpful regarding the approaches and differentials. And I used to write each and everything you were discussing after each case. And I started my presentation with station 4 in this case, in this course. And you always, one thing you mentioned that no one ever mentioned me to focus on my tone. And in the exam, the first station I got was the station 4. And so I reminded myself outside the station just to focus on my tone when I go inside. And also the things you mentioned whenever I was practicing this station with you. So it went well over there. And in the mid of the even this station, it always came in my mind, whatever you told me to focus for this station. So it went well over there, this station 4. One thing that I missed in this station was one concern, because the surrogate, he was very smart, and he was very fluent. So he asked 3 concerns at a time. So, and when I failed to finish 3 concerns, address 3 concerns, and he continued with the other concerns. So I just tried to focus on appropriately to answer that, to address the concerns. And in this station, I got 13 out of 16. And the other things you were very pointed me for station 5, the time management. And also I focused on that. after in my routine practice with my colleagues. And Alhamdulillah, it went well over there. And I got full marks in both stations, station 5. And the other clinical stations also, I did 2 stations with you. And in that station, I came to know about how to be quick in time, and I practice in my routine practice. And they all went very well, Alhamdulillah.
Alhamdulillah.
And I'm thankful to you, sir, that the approaches and all the explanation you are giving after each case, I used to write it and I used to revise it the next day as you advised always, not to leave it for later on. So that helped me a lot. So thank you so much for your great efforts and your precious time for us.
You are very welcome, doctor, and thank you for joining us. And we are proud of your result, and we wish you all the best ahead, mashallah. Okay, it's not easy to pass, okay, this PACES exam. And just one question to you that I have asked all my candidates before. Among all the stations in your carousel, which station you found most difficult on that day?
Sir, clinical, I was very much confident about the clinical, each station I was leaving. The history station, though I was finished my history station 2 minutes before the time, and I tried to cover each and everything. And in clinical communication, overall, I got full marks. I don't know where they deduct my marks. It's the only station where I lost 7 marks. And I tell the differential, and the examiner, he did some confusing questions, not confusing. He was just trying to make me confused, like whatever investigations he was asking, I was telling the right way. And he asked me to tell the investigations, why you want to go for these investigations and what you want to look for that in that investigations. And he just kept me confused with CBC only for 2 minutes. And I was telling the correct way, like in X-ray, what you will like to see in X-ray. I saw that was my top differential was eclasia, and I said widening of mediastinum, and he was giving me asking me, do you think it will be like this in ecclesia? So he tried his best to confuse me in that viva of station, history station. That was my second last station. And when I will get the feedback, I will come to know where I lost marks in history, or maybe in differential or clinical judgment, because in communication it's full. So
All
that
right.
was a difficult station for me.
All right, no worries. Now that you have passed, what happened in there is not does not matter that much, but the times in the exam. Okay, so what we conclude from your experiences, from the candidates who have taken the exam recently, that I hope all of you agree with me from even my experiences, that station 5 is the key to pass this exam. And how you approach station 5, it's going to decide whether you're going to make it or not. Of course, you need to back up on the other station, but the backup plan for the other station, okay, like if you have 4 clinical station, whether it be abdomen, respiratory, the cardio and neuro, okay, if when one goes really bad, okay, let's say the other one also goes bad, if you get 8 out of 20 in 2 clinical station, but if you get well, I mean, if you do well in the station 5, still you can pass. However, if you somehow one station 5 goes bad, it's going to be really difficult to pass. You need backup from the other station. But if both station 5 somehow you score less mark, then it's difficult to to sum up the overall mark and also to score individual marks in the individual skills. So the station 5 is the key to pass this exam, and that's what we learn from the candidates. Even those who have passed, they all had to struggle with the station 5, and they all made it possible. They all overcome this difficulty, and they all show and inspire us that it's doable. Thank you, Dr. Nadia, for your presence and your lovely feedback. Okay, you will be in our prayers, and do keep us in your prayers. And I ask all of you that not only remember us in your prayers for this world, remember us, I mean, when you pray, remember that so that we can have a better life in the afterlife as well. Okay, that's what we learn as we grow old. Thank you, Doctor. Dr.
Thank you so
Sahar,
much.
you're welcome. Dr. Sahar, are you with us? She's with us. I don't know if she's having some connection issues, but I'd love to hear a few words from her. Dr. Sahar, are you with us? All right, perhaps she is, just check. Okay, it's the connection somehow. Okay, so no worries. We're going to have Dr. Sahar some other day. She's having some connection issues at the moment. All right, so we tried to involve our past candidates to congratulate them upfront. I wanted to do this earlier, but recently, there were some unfortunate events. I lost one of my senior brother back in Bangladesh, and today also, I mean, right before I wanted to, start the session, I also came across a very bad news. Okay, the death of one of our aunt, a very close, sister of mine. I mean, she's a colleague as well. Her mom passed away this morning, so my condolences and my prayers so that Allah grant her Jannah. And every day people dies. Okay, and the other day, just 3 days back, I wanted to do this session with you. Everyone was ready, but all of a sudden, I received this news that he was a doctor. He was a very young one, and he worked with me once, okay, for some time. Then he got into another department, and he was very young. He left us, you know, just suddenly. He just had the diagnosis of dengue, and he had encephalitis, and everything happened so suddenly before any measures could be taken. He left us. So life is very unpredictable. All of us know it, but we don't realize it often until or unless we come across losing any of our loved ones. Okay, and so that's why I encourage everyone that remember one thing, that the exams you take, it's for your life, but do not give your life for the exams. Doctors, that take the most stress, what I believe. Okay, all of you take a lot of stresses. Okay, but you should also focus on your health, and doctors are the worst patient. When you are a patient, perhaps you ignore many of your symptoms, so please don't ignore. Take care of your health. That's very important. All right, so just keeping this in mind, we'll go ahead with the rest of our session. We'll do some cases with the candidates who are going to take the exam in coming days, inshallah. So thank you again for all the past candidates who have joined us. It was lovely to have you again, and we miss you. And hopefully, we're going to remember each other in our prayers, and the ones we have lost, our near and dear ones, inshallah. So we'll just go with the cases now.
Thank you, sir. Thank you. Allah Hafiz.
Allah Hafiz,
Thank you so much. Allah Hafiz.
Allah Hafiz, Dr. Nadia and others.
Thank you, doctor. Thank you.
You're welcome, Dr. Suresh. Thank you. Thank you, everyone.
Well, Dr. Janas, sorry, I couldn't join, but I am just, want to say thanks a lot, because
Dr.
I
Sai is
really
with us.
learned,
Okay.
and yeah, you give us the platform to practice real. What I have learned, you're never perfect. You give that go ahead. You never say perfect. So this, creates a lot of improvement, and this is the thing that make it unique from you, from other mentors, that you say good try but needs more improvement. And finally, on the exam day, we have done alhamdulillah so well that examiner said you have still time. So time management, and I think in PACES, it's only time management that matters a lot. So I'm really grateful to you. Alhamdulillah, I have cleared, and a lot of things I have learned, and I really found you a great mentor. Everyone who is asking me what should I do, so I reply, first join KGI, then you will know all the things that you have to do. So thanks a lot.
All right. Thanks a lot, Dr. Saha. Even with this difficult time, you have joined us. And Dr. Saha is someone who inspires me. She has a huge responsibility. Her kids are grown up, but she has taken the exam, and she has to go to Pakistan to take the exam. And it's a lot. Like people who, travel a long distance and then take the exam, they would know better that what does it feel like, the hangover, than taking any courses. Okay, but I know that all of you, many of you do various courses. You have to do clinical courses, but what's the main point is that to be focused. Okay, just to grab the things fast and know where you have to explore further. Okay, because they would give you a lot of signs. That's what, it's not that mine is the best. I never tell anyone that I'm going to, if you join my course, you're going to pass in first attempt. I never claim that, but I can guarantee you that you'll be guided well and you'll feel more confident. And I believe all the candidates who have passed, they felt more confident on that day. Okay, and I have that faith in me, alhamdulillah. And many thanks to Allah. All credit goes to Allah, because it was his will that you'd pass this diet. Okay, and I was just, I'm not just being humble, but it's the truth that it's lovely to be a guide, okay, for this noble cause, where you are actually planning to prepare for this great exam, which improves your skills as well as the way you communicate with your patient. And everything is lovely in this exam. The practical experience of seeing patients, to practice the communication, to develop your skills, which you can apply in real life, and you get to be a better doctor. And patients really like you once you start practicing like you do in the PACES, in your real, GP center, when you talk with the patients with that much, sympathy and empathy. Okay, so I think the overall PACES, when you prepare for it, you develop yourself to such extent that you become a great doctor. And I have witnessed so many great doctors so far. All of you who have passed PACES are great, mashallah. Thank you again, Dr. Saha, for coming by and giving your valuable feedback. All your feedbacks are valuable to me and lovely. So just remember me in your prayers.
Sure,
and
inshallah. Thanks a lot.
Thank you, Dr. Jazakallah, everyone. Okay, so we'll now stop our live stream and we'll go for the cases.